Which of the following findings is associated with thyroid hypofunction? Mesoderma. A 14-year-old boy is brought in by his mother, who reports that her son has been complaining for several months of recurrent bloating, stomach upset, and occasional loose stools. She reports that he has difficulty gaining weight and is short for his age. She has noticed that his symptoms are worse after eating large amounts of crackers, cookies, and breads. She denies seeing blood in the boy's stool. Which of the following condition is most likely? The answer is celiac disease. Number 3. A 67-year-old female patient presents with a 3-day-old cat bite that has become swollen, reddened, and painful to the touch. The nurse practitioner notes there is purulent discharge at the site of the bite. Which medication will the nurse practitioner prescribe? Amoxicillin, clavulanate, augmentin. Number 4. A 14-year-old girl with short stature, swollen hands and feet, and a webbed neck presents to the primary care clinic. Upon assessment, she is found to be at Turner stage 1. Which tests will the nurse practitioner order to confirm a diagnosis? The answer is karyotype. It's a test for Turner syndrome. Number 5. A 67-year-old woman with a 30-year history of smoking presents for routine annual physical examination. She complains of being easily short of breath and is frequently fatigued. Physical examination reveals diminished breath sounds, hyperresonance, and hypertrophied respiratory accessory muscle. Her complete blood count CBC results reveal that her hematocrit level is elevated. Her pulmonary function test PFT results show increased total lung capacity. Which diagnosis is most likely? The answer is chronic obstructive pulmonary disease, COPD. Number 6. An elderly male presents to the clinic for a routine examination. The nurse practitioner notes multiple rough, scaly patches on the patient's forearms and face and the back of his ears. Which diagnosis is most likely? The answer is senile actinic keratosis. Number 7. The nurse practitioner is assessing a 63-year-old male who has a history of intravenous drug use. As a young adult, he presents with fatigue and nausea. Which screening will the nurse practitioner recommend for this patient? The answer is hepatitis C. The nurse practitioner is performing an assessment of a 6-month-old child. What motor skills are expected at this age? The answer is selector that apply. The answer is palmar grabs of objects and sit up. Number 9. The nurse practitioner is managing a stable 65-year-old patient with emphysema. In addition to reinforcing smoking cessation and medication schedules, which annual intervention will the nurse practitioner recommend? Quadrivalent inactivated influenza vaccine, QIV. Number 10. During a sport participation exam of a 14-year-old high school athlete, the nurse practitioner notices a split of the S2 component of the heart sound during deep inspiration. She notes that it disappears upon expiration. The heart rate is regular and no murmurs are auscultated. Which of the following is correct? The answer is, this is a normal finding in some young athletes. Number 11. Which findings will the nurse practitioner expect to see in a 13-year-old male patient with Cushing's syndrome? The answer is delayed puberty. Number 12. Which lifestyle factor is associated with secondary polycythemia vera? The answer is smoking. Number 13, which test will confirm the diagnosis of prostate cancer? The answer is tissue biopsy. Number 14, a 60-year-old female truck driver presents to the outpatient urgent care clinic of a hospital complaining of the worsening of her low back pain the past few days. Pain is accompanied by numbness in the perineal area. She describes the pain as sharp and burning and points to the left buttock. She reports that the pain started on the mid-buttock of the left leg and recently started to go down the lateral aspect of the leg towards the top of the foot. During the physical exam, the ankle jack and the knee jack reflex up 1 plus on the affected leg and 2 plus on the other leg. The pedal, posterior tibialis and popliteal pulses are the same on both legs. Which of the following tests should the nurse practitioner consider for this patient? The answer is order an MRI scan of the lumbosacral spine as soon as possible. Number 15. When assessing a patient using a Snellen chart, the nurse practitioner records the visual acuity as 20/80. What does this assessment mean? It means the patient can see at 20 feet what a person with normal vision sees at 80 feet. An obese 28-year-old female patient is seen in the office with acne, hirsutism, and oligomenorrhea. Blood is drawn for a free androgen index and results reveal 9.8 level. The diagnosis is polycystic ovarian syndrome, which puts the patient at additional risk for which conditions? Select all that apply. The conditions are: answer, metabolic syndrome, infertility, and type 2 diabetes mellitus. Number 17. A middle-aged hypertensive man presents to the public health clinic with complaints of an acute onset of fever, chills, and cough that is productive of rusty-colored sputum. The patient reports episodes of sharp pains on the left side of his back and chest whenever he is coughing. His temperature is 102.2. Pulse is 100 beats per minute and blood pressure is 130/80. The urinalysis does not show leukocytes, nitrates, or blood. These findings are most consistent with bacterial pneumonia. Number 18. During a physical examination, the nurse practitioner palpates the right upper quadrant while the patient takes a deep inspiration. Which diagnostic test is being performed? It's Murphy sign. Number 19. An elderly fair-skinned male presents to the clinic for a routine examination. The nurse practitioner notices a lesion on his nose. The lesion is a small translucent purple with a central ulceration, telangiectasis, and road borders. Which diagnosis is most likely? Is a basal cell carcinoma. Things to note: Marco test, raised heels and drop suddenly, Rosen's signs, deep palpation of lower left quadrant of the stomach, Psoas test, abdominal pain while flexing the hip. Number 20. A cauliflower-like growth with foul-smelling discharge is seen during an otoscopic exam of the left ear of an 8-year-old boy. with a history of chronic otitis media. The tympanic membrane and ossicles are not visible, and the patient seems to have difficulty hearing. The nurse practitioner instructs which condition is most likely. Cholesteatoma. An elderly patient with new onset of sleepiness, weight gain of 10 pounds in a month, xerosis and anemia. The patient's lab values are free tyrosine T4 of 0.8, thyroid stimulating hormone TSH of 7.2, and a score of 28 on the mini mental state examination. Which medication would a nurse practitioner prescribe? Levothyroxine Synthroid. Which of the following selective serotonin reuptake inhibitors, SSRI, is most likely to cause erectile dysfunction? Plesil, which is paroxetine. A 74-year-old male patient presents with an acute onset unilateral headache with a reddened and indirected temple. The patient is at risk for amaurosis forgas. Number 24. Upon auscultation of a 6-year-old patient, the nurse practitioner hears a systolic murmur that sounds like a musical vibration and becomes louder in the supine position. The murmur is a grade 1/2 in intensity with minimal radiation. The nurse practitioner will note on the record to monitor on annual physical exam. 25. All of the following would require the nurse practitioner to delay testing a patient's prostate-specific antigen except vigorous exercise 3 days prior. So in other words, if the patient is having urinary retention, if the patient is having urinary tract infection, if the patient is after a digital rectal exam, so the nurse practitioner has to delay the testing of the patient for prostate-specific antigen. 26. While performing a newborn assessment, the nurse practitioner notes discharge, swelling, and redness on one of the infant's lacrimal ducts. The mother reports crusting on the infant's eyes. Which diagnosis is most likely? Dacryostenosis. Let's find what is dacryostenosis. Dacryostenosis is an obstruction of the lacrimal ducts. Any discharge should be cultured and treated with an appropriate antibiotics. Number 27. During the physical exam of a 60-year-old adult, the nurse practitioner performs an abdominal exam. The nurse practitioner is checking the left upper quadrant of the abdomen. During percussion, an area of dullness is noted beneath the lower left rib cage. Which of the following is a true statement regarding the spleen? The spleen is not palpable in the majority of healthy adults. Number 28. An elderly male resident in a long-term care facility has suddenly developed a fever of 102.3 and is complaining of chills and pain that radiates from the perineal area to the rectum and back. The prostate is extremely tender, warm, and bulgy. Upon digital rectal examination, urinalysis reveals pyuria and hematuria. Which diagnosis is most likely? Acute prostatitis. A young adult with myasthenia gravis is diagnosed with pertussis. Which antibiotic is contraindicated in patients with this condition? The answer is erythromycin. Number 30, the nurse practitioner who is evaluating a patient with polycystic kidney disease will pay close attention to which area of the kidney? The renal tubules. Number 31, Haberdens nodes are commonly found in which of the following disease? Degenerative joint disease. Which of the following is a contraindication of the influenza vaccine? Age, younger than 5 months. A newly retired 60-year-old patient presents with a body mass index BMI of 32 and a waist circumference of 41 inches. His lipid panel shows total cholesterol of 200, high density lipoprotein of 35, and triglycerides of 175. His blood pressure is 124/70. All of the following findings put the patient at risk for cardiovascular disease except hypertension, which is blood pressure. A nurse practitioner sees a patient for an evaluation of sexually transmitted disease. Assessment reveals Fils-Hugh-Curtis syndrome. The nurse practitioner will prescribe ceftriaxone 500 mg IM times 1 dose plus doxycycline 100 mg BID times 14 days plus metronidazole 500 mg BID times 14 days. Let's find out what Fils-Hugh-Curtis syndrome is. Fils-Hugh-Curtis syndrome should be treated as a complicated gonorrhea or /chlamydia infection. So it's kind of gonorrhea and chlamydia infection. So you have to use combination therapy to treat it. A 46-year-old male patient presents at the urgent clinic with a swollen lower right leg that is reddened and tender to the touch. The patient reports no recent injury. However, he notes that yesterday he returned from a cross-country business trip. The nurse practitioner will ask the patient to perform dorsiflexion of the right foot. So, performing dorsiflexion of the right foot So a positive hormone sign, which is calf pain at dorsiflexion of the affected limb, is a sign of a DVT. Number 36. Which condition is associated with the findings in the radiograph? The answer is tuberculosis. The answer is tuberculosis. The radiograph of lung infected by a Mycobacterium tuberculosis. The causative agent is tuberculosis. The upper lobe is the most common location of TB infection of the lungs. The typical findings are cavitation, round black holes due to local loss of lung tissue, fibrosis, lymphadenopathy, and calcifications. Number 37. A 68-year-old female presents to the clinic complaining of increasing mid-back pain. Her past medical history is significant for treatment of gastroesophageal reflux disease, GERD, and a vertebral compression fracture at T2 1 year ago. An X-ray obtained during the encounter reveals a new vertebral compression fracture of T12. Oh, that was T11 and T12. Lab work reveals elevated serum alkaline phosphatase. The nurse practitioner notes 1-inch decrease in the patient's height from the previous year. Which medication will the nurse practitioner prescribe? The nurse practitioner will prescribe alendronate. The other name is Fosamax. It's given to patients with osteoporosis. A 45-year-old patient presents to the clinic with complaints of chills, fever, and malaise. Clinical findings show non-tender red spots on the palms of both hands and soles of the feet. Splinter hemorrhages on the nail beds are also noted. The nurse practitioner suspects which of the following conditions: ineffective endocarditis. A 4-year-old boy diagnosed with acute otitis media returns in 48 hours with a possible rupture of the tympanic membrane (TM) of the right ear. The mother reports seeing pus and small amounts of blood on the pillow that morning. The child says that his ear is no longer painful. During the ear exam, the otoscope is used to visualize the TM, which has a perforation on the lower edge that is draining a small amount of purulent discharge. All of the following topical ear medications should be avoided in patients with perforation of the TM, except ofloxacin ear drops. So basically, you use ofloxacin ear drops. Number 40. A possible side effect from the use of nifedipine Procardia is edema of the ankles and headache. The nurse practitioner is discussing tetracycline with a young sexually active female patient being treated for a bacterial sinus infection. The nurse practitioner will advise the patient to employ an additional method of contraception while on the antibiotic and for 1 pill cycle after treatment is complete. A 25-year-old male presents to the clinic with a low-grade fever and a single etcher on his back. He complains of burning at the site and states, "The area was white, then red. Now there is a red spot in the center." The patient knows that he recently traveled to the southeast for a camping trip. Which diagnosis is most likely? Brown recluse spider bites. The nurse practitioner is evaluating a middle-aged woman who has experienced gradual weight gain, lack of energy, dry hair, and an irregular period for the past 8 months. Routine annual laboratory testing showed a thyroid-stimulating hormone TSH level of 10. The nurse practitioner decides to order a thyroid profile. Results shows that TSH is 8.50 and serum free T4 is decreased. During the physical exam, the patient's body mass index BMI is 28. The heart and lung exams are both normal. Which of the following is the best treatment plan for this patient? The answer is start patient on levothyroxine Synthroid 25 mcg/PO daily. Number 44. All of the following findings are considered benign lesions of the skin except actinic keratosis. So we have to note benign lesions of the skin are lentigo, seborrheic keratosis, rosacea. So 45, number 45, which skin conditions produces honey-crusted pruritic vesiculopustules that rupture and cross? Impetigo. 46. A patient is diagnosed with Bell palsy and prescribed high-dose steroids for 10 days. With minimal improvement, during a follow-up visit, the nurse practitioner suspects the patient has HSV-1. Which medication will the nurse practitioner prescribe? Acyclovir. HSV is herpes simplex virus. Others virus, you use anything vir. Acyclovir is the answer. 47. A 6-year-old child with history of rheumatic fever is being examined by the nurse practitioner in a follow-up after hospitalization. Auscultation of the heart reveals a loud blowing, high-pitched murmur radiating to the axilla. Which diagnosis is most likely? The answer is mitral regurgitation. So let's look at other murmurs. What are the answers? So mitral regurgitation is a pan-systolic murmur heard best at the apex or apical area of the heart. It radiates to the axilla and is loud blowing. High-pitched murmur, rheumatic fever. A complication of untreated strep throat can damage the mitral valve, leading to mitral valve regurgitation early or late in life. So aortic stenosis is best heard at the right side of the sternum and is a harsh and noisy murmur. Mitral stenosis is a low-pitched diastolic rambling murmur. Aortic regurgitation is also a blowing high-pitched murmur, but it is heard at the right side of the sternum. Good. Let's go back. Number 48. A 29-year-old female patient presents to the clinic with complaining of painful sexual intercourse and pain when urinating. The patient's temperature is 100.1. Upon physical examination, the nurse practitioner notes a healthy appearance of the internal and external genitalia. The patient has lower abdominal and cervical motion tenderness in response to palpation. What will the nurse practitioner order to confirm a diagnosis and determine the appropriate treatment? The answer is cervical culture, which indicates endometritis. So number 49. An elderly female is diagnosed with tic douloureux, which assessment finding is related to? Type 1. The answer is shock-like facial pain. So number 50. An 11-year-old male presents with lower right-sided abdominal pain, an elevated temperature, and a white blood cell WBC count of 17,000. He complains of nausea and vomiting over several days. The nurse practitioner flexes his right leg at his hip and knee, which results in moderate discomfort. Which diagnosis most likely? Appendicitis. The nurse practitioner is reviewing the charts of an 8-month-old infant scheduled to receive immunization. Which vaccination will the nurse practitioner question if noted in the infant's chart? The answer is measles, mumps, and rubella. MMR vaccine, 0.5 ml subcutaneous. The nurse practitioner has to question those because the baby has to get it after 12 months or 12 months. Number 52. A 56-year-old patient presents to the clinic with reports of right hip pain that worsens after activity, decreased range of motion of the right hip, and difficulty getting up after sitting for long periods. The nurse practitioner hears crepitus in the right hip upon movement. Which condition is most likely? Osteoarthritis. Crepitus in the right hip upon movement indicates osteoarthritis. Number 53. The nurse practitioner refers a 12-year-old boy with a swollen red scrotum and ascending testicle to the ED with a diagnosis of testicular torsion. Which additional objective finding led the nurse practitioner to this diagnosis? The answer is missing cremasteric reflex. Number 54. Which of the following is a warning sign for scoliosis? Is raised right iliac crest. Number 55. A nursing home resident reports that his previous roommate was recently started on tuberculosis treatment. A mantle test and chest X-ray are ordered for the patient. What is the minimum size of induration considered for positive for this patient? 5 mm. Number 56. The nurse practitioner is treating an elderly female patient with recurrent depression. The patient refuses to take her medication. The patient's daughter states, "She seems worse than ever. What should we do?" Which of the following is the most appropriate response? I will refer your mother to a psychiatric mental health nurse practitioner. 57. An elderly patient is diagnosed with urinary tract infection. Which drug class may put this patient at risk for an Achilles tendon rupture? The quinolones. 58. Which statement will the nurse practitioner make when discussing prostate cancer screening with a 65-year-old African American patient? The answer is screening offers only a small benefit of reducing the chance of death from prostate cancer. Therefore, you can choose whether or not you want to be screened. Number 59. A 32-year-old sexually active female is diagnosed with bacterial vaginosis (BV) based on findings of copious milk-like vaginal discharge. Speculum exam reveals gray-white discharge on the vaginal walls and fish-like odor. Based on the wave test, the patient will be treated with a 5-day course of metronidazole vaginal gel, 1 application at bedtime, and advised to do which of the following? The answer is abstain from sexual intercourse during treatment. Number 60. A 66-year-old female dual energy X-ray absorptiometry DEXA scan reveals early onset osteoporosis. The nurse practitioner will recommend all of the following except decrease weight-bearing activities. So, an 18-year-old female patient is being followed up for acne by the nurse practitioner. During the facial exam, papules and pustules are noted mostly on the forehead and the chin areas. The patient has been using over-the-counter topical antibiotic gels and medicated soap daily for 6 months without much improvement. The nurse practitioner will recommend tetracycline. Another name for it is somycin. Number 62. Which hemopoietic disorder will the nurse practitioner assess for a 3-year-old child with lead poisoning, iron deficiency anemia? A patient has been taking albuterol via a metered-dose inhaler for a month and remains in the yellow zone. Which of the following statement is true? The patient is at 50 to 80% of their personal best. Number 64. Upon examination of a 26-year-old patient, the nurse practitioner finds elongated papilla of the lateral aspect on the patient's tongue. How will the nurse practitioner document this finding? The answer is oral hairy leukoplakia. Let's see what it is. Oral hairy leukoplakia. Oral hairy leukoplakia. Oral hairy leukoplakia. Leukoplakia presents as an elongated papilla of the lateral aspect on the tongue. The Epstein-Barr virus is the causative agent of oral hairy leukoplakia. Then we have to also note that Koplik spots present as clusters of small red papules with white centers located on the buccal mucosa by the lower molars. Koplik spots are a prodromic viral enanthem of measles. So Koplik spot is associated with measles, while oral hairy leukoplakia is associated with Epstein-Barr virus. Is commonly seen with AIDS patients. So, a patient, number 65, a patient presents with a new onset of jaundice, sclera, right upper quadrant tenderness, and anorexia. The nurse practitioner draws labs with the following results: AST 24, ALT 13, HBS antigen equals to negative, anti-Hep C negative, anti-HBS positive. How will the nurse practitioner interpret this data? The patient has immunity from hepatitis B vaccinations. Which of the following laboratory tests is the most sensitive test for evaluating an active Helicobacter pylori infection of the stomach or duodenum? Urea breath test is the answer. Helicobacter pylori, urea breath test. Number 67. A male patient presents with reports of urethritis, migratory arthritis in the large joints and ulcers on the glands beneath, secondary to a chlamydia infection. The nurse practitioner will implement all of the following interventions except treat with alpha-linolenic acid. So let's do the nurse practitioner. The right thing to do, the right interventions are treat with non-steroidal anti-inflammatory drugs, NSAIDs, prescribe antibiotics to treat infection, and recommend rest and comfort measures. That's what to do. But what not to do is to treat with alpha-linolenic acid. Number 68. An adolescent patient uses a sliding scale in conjunction with a long-acting insulin to manage type 1 diabetes. Which insulin should the patient prepare for an elevated blood sugar between breakfast and lunch? It's insulin Lispro. The nurse practitioner performing a vision screening on a newborn, which finding would prompt a referral to a pediatric ophthalmologist. One eye turned inward. Number 70. A 72-year-old female patient has a complicated urinary tract infection. Which regimen will the nurse practitioner prescribe? Medication treatment for a minimum of 7 days. Which mineral lab finding is deficient in a patient presenting with lethargy, weight gain, bradycardia, and goiter? The answer is iodine. 72. What is the least common pathogen found in community-acquired pneumonia? Let's read the question again. Number 72. What is the least common pathogen found in community-acquired pneumonia? The least common pathogen is Pseudomonas aeruginosa. Then 73. The nurse practitioner will monitor for all of the following side effects in a patient taking hydrochlorothiazide except hypernatremia. A patient newly diagnosed with diabetes mellitus has a body mass index BMI of 32.5, creatinine of 1.2 mg per dl, blood urea nitrogen BUN of 20 mg per dl, and fasting blood sugar of 186 mg per dl. The patient also has a history of bladder cancer. Which is the most appropriate drug class for this patient? The answer is biguanides. Number 75. An elderly patient is diagnosed with herpes zoster ophthalmicus. Which cranial nerve is infected with this disorder? The answer is cranial nerve number 5. Then number 76. The patient presents to the primary care clinic with complaints of headache, non-productive cough, and fatigue for the past 2 weeks. The nurse practitioner auscultates crackles and wheezing. A chest X-ray shows patchy infiltrates. The patient does not have comorbidities or recent use of antibiotics. What is the most appropriate treatment for this patient? The answer is azithromycin Z-Pak daily times 5 days. The nurse practitioner has confirmed a diagnosis of acute hepatitis C in a patient. The nurse practitioner is required to do which of the following? Is required to do which of the following? Is required to do which of the following? Report the case to the health department. Number 78. Following a routine annual exam of a 59-year-old postmenopausal patient, the nurse practitioner refers the patient to a gynecologist, who then orders a pelvic intravaginal ultrasound. Which finding on the exam most likely prompted the referral and subsequent orders? Palpable ovary. Ovary should not be palpable. Number 79. A high school football player suffered a declaration pivoting injury of his left knee. During a game, he states he felt a sudden pop, with subsequent swelling, and the knee seemed to buckle. The nurse practitioner will select all that apply, will conduct a Latchman test, apply ice to the joint, support the joint with a compression wrap, and refer to an orthopedic specialist. Number 80. Which diagnostic test is used to confirm a diagnosis of vaginal candida infection? The answer is Wait-Month. Number 81. A 65-year-old woman who has had type 2 diabetes for 20 years is concerned about her kidneys. She has a history of 3 urinary tract infections, UTIs, within the past 8 months, but is currently asymptomatic. The nurse practitioner will recheck urine during the visit, send a urine specimen for culture and sensitivity, and refer to a nephrologist. Number 82. Which of the following is associated with male aging? Decreased sperm production. Number 83. An underweight 15-year-old female cross-country runner presents with a complaint of progressive bilateral leg pain for 5 to 6 weeks. Upon examination, the nurse practitioner notes inflammation in the left tibia area and that the patient has pes planus. Patient history reveals amenorrhea for 1 year. Which diagnosis is most likely? The answer is medial tibial stress syndrome. Number 84. Which lab results suggest a diagnosis of hypothyroidism? The answer is elevated thyroid stimulating hormone, TSH, and low free T4. Number 85. The nurse practitioner is caring for a 4-year-old patient with sickle cell disease who is experiencing a febrile illness. Which hemopoietic laboratory value will the nurse practitioner use to evaluate the efficiency of the patient's bone marrow response? The answer is D, reticulate count. Number 86. When examining a school-age child, the nurse practitioner notes wheezing and diffuse crackles. Upon auscultation of the lungs, throat examination appears erythematous, without pulse or exudate. Respirations are 24 and temperature is 99.2 degrees Fahrenheit. The mother states the child has been coughing for several weeks. Chest X-ray shows diffuse interstitial infiltrates. The nurse practitioner orders all of the following except albuterol nebulizer. So basically, for this problem, the nurse practitioner should order an anti-intrusives, PRN, increased fluids, and then azithromycin times 5 days, but not to order albuterol nebulizer. Number 87. A woman who was recently diagnosed with lupus complains that her hands and feet always feel cold, even in the summertime. Sometimes her fingertips become numb and turn a blue color. The fingertips eventually turn dark red in color. Which of the following is most likely? Raynaud's phenomenon. The answer. Number 88. A trio initially presents at which grade level of heart murmur? Grade 4 of heart murmur. Number 89. The nurse practitioner is educating a 72-year-old patient regarding screening for colon cancer. The patient is at average risk. What diagnostic testing should be performed annually for this patient? Fecal occult blood testing. 90 Number 90. A patient has several well-defined primary lesions, less than 20 mm over the trunk and extremities. After completing a dermoscopic exam, the nurse practitioner diagnoses Bowen's disease. Which treatment will the nurse practitioner recommend? Curettage and electrodesiccation. Number 91. A 5-year-old child is assessed for dysuria and frequency. Which antibiotic would the nurse practitioner prescribe upon finding the urine culture positive for gram-negative bacteria? The answer is trimethoprim, sulfamethoxazole, Bactrim DS. Number 92. A patient presents with a wedge-shaped superficial yellow triangular mass on the nasal side of the left eye. The patient denies pain or vision changes. Pallor is normal. Which diagnosis is most likely? It's a pterygium. Pterygium. Let's read further and see what this is. Pterygium. Pterygium, number 92. Pterygium. The patient has a pterygium, which is a yellow triangular thickening of the conjunctiva that extends across the cornea on the nasal side. Pinguecula is a yellowish raised growth on the conjunctiva next to the cornea. Then a chalazion is a chronic inflammation of the meibomian gland. Then a hodulum or style is an abscess of a hair follicle and sebaceous gland on the eyelid. Wow. So I have to know these three things: pterygium, pinguecula, chalazion, and hodulum. So number 93. A toddler who was born prematurely is being assessed for hearing loss. Which history finding places this child at high risk for hearing loss? Low APGAR scores. What are USPSTF recommend guidelines for breast cancer screening? Answer is a baseline mammogram should start at age 50 and repeat every 2 years until age 74. Whoa. 95. What is the priority treatment for a patient who presents with an asthma exacerbation? Answer: apply nebulizer treatment. 96. The nurse practitioner is screening a 1-week-old newborn for congenital heart defects and measures 91% oxygenation in the right hand and 95% in the left hand. The nurse practitioner will repeat screening in 1 hour. That's the answer. Which of the following findings is most likely in young primigravidas with pregnancy-induced hypertension? The answer is edema of the face and upper extremities. Number 98. While reviewing lab results for a patient with suspected recreational drug abuse, the nurse practitioner notes an elevated blood urine nitrogen (BUN) level. Which additional tests will the nurse practitioner order to confirm or rule out renal failure in this patient? Estimated glomerular filtrate rate (eGFR). Number 99. All of the following are known to cause chronic cough except acute viral upper respiratory infection (URI). Number 100. Which assessment finding is associated with a diagnosis of proximal hypospadias? The answer is CHORDE. CHORDEE. Number 101. A 2-day-old full-term infant presents with jaundice symptoms. Which of the following interventions should be implemented first? Check bilirubin level. That's the answer. A nurse practitioner sees a fair-skinned patient who is experiencing recurrent small acne-like pustules and papules of the cheeks, nose, and chin, as well as chronic dry eyes. Which diagnosis is most likely? Acne rosacea. Let me read this again. A nurse practitioner sees a fair-skinned patient who is experiencing recurrent small acne-like pustules and papules on the cheeks, nose, and chin, as well as chronic dry eyes. Which diagnosis is most likely? Acne rosacea. Number 100. A 10-year-old child presents with external ear pain, swelling, and decreased hearing in the left ear. The child is on a swim team and practices daily. Upon physical examination, the child does not want the left ear touched. There are no other abdominal findings. The nurse practitioner will advise the patient to do all of the following except apply steroid nasal spray BID times 1 week. So basically, the best approach would be use aluminum acetate solution PRN, keep water out of the ear during treatment, apply polymyxin B, neomycin, hydrocortisone suspension drops QID times 7 days. But you should not apply steroid nasal spray BID times 1 week to it. Number 104. The nurse practitioner is evaluating a 72-year-old male with an acute flare-up of gout. Which medication will the nurse practitioner prescribe? Colchicine. The nurse practitioner notices a medium pitch harsh systolic murmur during an episode examination of a 37-year-old woman. It is best heard at the right upper border of the sternum. Which condition is most likely? It's called aortic stenosis. The nurse practitioner has diagnosed a 78-year-old female patient with stress urinary incontinence. Which of the following is the most appropriate initial treatment for this patient? Kegel exercise. 107. A patient who has been prescribed warfarin is advised to avoid eating large amounts of leafy green vegetables for which of the following reasons? The high vitamin K levels will decrease the international normalized ratio. Number 108. A middle-aged female patient is seen by the nurse practitioner for a hypertension management follow-up. The patient has been taking clothalidone 12.5 mg daily for 30 days and has a history of smoking, emphysema, and breast cancer. The patient's current blood pressure is 168/92. What adjustment will the nurse practitioner make to the treatment plan? The answer is increase clothalidone. Number 109. The nurse practitioner is performing a sports participation physical for a high school football player. His body mass index BMI is calculated at 26, and his mother is concerned that it is too high. What educational information should a nurse practitioner share with the patient and parent? BMI can be falsely elevated in people with higher muscle mass. Number 110. Which class of diuretics can be prescribed to patients with serious sulfur allergies? The answer is potassium-sparing diuretics. The nurse practitioner orders a 24-hour urine collection for a patient with suspected kidney disease. The test measured all of the following except. Let me read this question again. The nurse practitioner orders a 24-hour urine collection for a patient with suspected kidney disease. The test measures all of the following except glomerular filtrate rate. In other words, the test measures proteinuria, albuminuria, microalbuminuria, but except glomerular filtrate rate. So number 112. An 82-year-old female presents to the nurse practitioner with fatigue and complaints of watery diarrhea. She states she may have a dozen watery stools per day, accompanied by stomach cramps. Upon assessment, the nurse practitioner notes the patient is currently taking a course of antibiotics for acute bronchitis. Which diagnosis is most likely? Let me read it again. An 82-year-old female presents to the nurse practitioner with fatigue and complaints of watery diarrhea. She says she may have a dozen watery diarrhea per day, accompanied by stomach cramps. Upon assessment, the nurse practitioner knows the patient is currently taking a course of antibiotics for acute bronchitis. Which diagnosis is most likely? Clostridium difficile colitis. That's the answer. Number 113. The nurse practitioner orders a pulmonary function test for a patient exhibiting signs of an obstructive lung disease. All of the following are differential diagnoses except pulmonary fibrosis. Which hematologic finding would be expected in an 18-month-old patient diagnosed with beta thalassemia minor? The answer is decreased hemoglobin A. Number 115. The nurse practitioner is screening a patient for melanoma using the ABCD acronym. Which lesion size is an abdominal finding? C. Diameter greater than 6 mm. So let's read more about these lesions. 115. Lesions. In the ABCDE acronym for melanoma screening, the D is for the diameter of a lesion. If the lesion is larger than 6 mm, 1/4 inch, with asymmetry, border, irregularity, color, variety, and enlargement over time, the patient should be referred to a dermatologist. So, number 116. A 25-year-old patient with a history of diabetes is positive for serum ketones and has a serum glucose level greater than 300 mg per dl. Which diagnosis is most likely? It's diabetic ketoacidosis. So, diabetic ketoacidosis. Then, diabetes insipidus is an underproduction of antidiuretic hormone. It does not create ketones in the blood. So, hypoglycemia causes low blood glucose levels. The small g phenomena is rebound hyperglycemia following an episode of hypoglycemia. So, number 117. Which medication can be prescribed to a patient to manage both hypertension and benign prostatic hyperplasia? It's terazosin. Then terazosin. Then finasteride is used to treat symptomatic BPH. Which is if the blood pressure is low and the BPH is, then other signs of BPH is present, we can use finasteride